This is part 2 of medication administration, where we're going to focus on how to actually administer medications using our 3 checks. Before we administer any medication, we must do the 3 checks. We do the 3 checks every single time we administer medication. This is our safety check. This is where we're going to catch any errors and prevent patient harm. Failure to do the 3 checks is what allows errors to occur. Before we do any checks, we need to make sure our MAR is accurate and the provider orders are complete. EMR does all of this for us, with us just needing to check that the orders came in. But in the paper charting world, we have to do this manually. We need to make sure that we check the home medication reconciliation sheet and the order sheets when we check that paper MAR. Remember when we discussed pharmacology and I mentioned the things nurses needed to know about medications? This is when that information is needed. Nurses need to know the action, therapeutic purpose, normal dosage, usual route, potential side effects or drug interactions, and nursing implication, including assessment needs before giving any medications. After we check our MAR for accuracy, and while we do our 3 checks, we're focusing on the 6 rights of medication administration. There are more than 6, but everyone likes the number 6, so we still say it. When we do the checks for medications and using the 6 rights, we're checking to make sure we are giving the right drug to the right patient at the right time, by the right route, the right dose, and we're doing the right documentation. While we check each medication against those 6 rights, it's ensuring that we have the right medication. In addition to these 6 rights, people have the right to refuse medications. However, they must have the right knowledge to be able to refuse, so we have to educate the patient on why they need the medication and what could happen if they don't take the medication before we allow them to fully refuse. We also need to make sure we're giving the medication for the right reason. We do the right assessments before giving the medications, and we evaluate the patient for the right response to the medication. Nurses are so much more than medication passers. We do all of this and then more. The first check we do is in the medication room when we're removing the medications from whatever medication delivery system our facility uses. If our facility uses drawers or an automated machine, we need to make sure that we are taking our medications from the correct patient source. We double check this by using the name and date of birth from our MAR. We then remove the actual medication we need, checking the medication's name against our MAR to make sure it's the correct medication, the correct time to be given, and the correct dose and the correct route. Then we need to make sure that that medication is not expired. Remember, there's an expiration date on the medications. We also need to make sure that this medication is not an allergy for the patient. At this point, we're going to leave all of our medications in their packaging. The second check is done outside of the medication room at the nurse's station. This may change depending on your facility's policy. First, you will compare the medication with the MAR again. You will check again the patient's name and date of birth, the medication, dose, route, time, and allergies. You will double check again your math and verify with another RN as needed for high alert medications like heparin or insulin. You will double check again why is the patient receiving this medication and is the dose, time, and route appropriate. You will then open the packaging if required to cut or crush any pills. If pills require cutting or crushing, you'll place it into a labeled medication cup with the drug name, dose, route, and expiration date. If a multi-dose container is being used, place it in an individually labeled cup. Any pills you do not need to be cut can be left in their closed packaging. If you have any parenteral medications to give, this will be when you draw up any injectable medications into their labeled syringes. The third and final check is our last time to catch any errors. This is a critical step that often gets missed. This step is done at the patient's bedside. First, perform standard precautions, including hand hygiene and appropriate PPE. Next, you will identify the patient with 2 identifiers, name and date of birth. Have the patient verbally say their name and date of birth while you compare it to the MAR and ID band. Check for any allergies by asking the patient and checking your MAR. Next, you'll complete any necessary assessments like blood pressure, apical heart rate, or pain level. Recheck your medications against the MAR one last time for medication name, dose, route, time, and expiration date. Then you can give the patient their medications. If you're working in a facility that uses EMR, the 3 checks may look a little different. Follow your facility's policies and procedures, but typically EMR will have you check meds against the MAR when you pull it from the medication supply drawer. Then typically you do the checks 2 and 3 at the bedside, preparing and administering the medications at the bedside. Do not skip these steps just because you have EMR. EMR made us less safe. After giving medications, nurses have the responsibility to monitor the effectiveness of medication. Remember the nursing process. Medications are interventions and we must reassess and evaluate our patients. We may need to notify the provider if the medications were not effective, if they're producing an undesired effect, or if they're no longer necessary. After we administer the medication, we're going to document on the MAR immediately. If the MAR is paper, we cross out the time with a single line and write our initials next to it. We sign and initial the bottom of the MAR. If the medication required an assessment prior to administration, like blood glucose or heart rate or blood pressure, we'll write that data on the MAR. If our medication is PRN, we're going to write the rationale for the PRN medication on the MAR. If you're using an EMR, you're going to document per the EMR documentation. If we decide not to give a medication, we circle the time, we do not write our initials, and we document why we held the medication on the MAR. Now that we talked about how to safely administer medications to prevent errors, let's talk about errors. This picture is one of my favorites. It's called the Swiss cheese model, and this one is specific for medication errors, but the concept can be used for almost all errors. Think about Swiss cheese. It's full of holes, right? Sometimes the holes line up and then we have a tunnel all the way through the cheese, and sometimes the holes stop and start up somewhere else. Think about all that has to occur for a medication from ordering to actually giving the medication. First, the medication is ordered from the provider. If it's ordered incorrectly, the EMR should catch the error. The error stops and that Swiss cheese hole is closed. But what if that EMR doesn't stop the error? Then it moves through that hole deeper into the cheese. Hopefully the pharmacist transcribing and dispensing the medication catches the error and closes the hole in that cheese. But if they don't catch the error, it moves through the hole deeper into the cheese tunnel closer to the patient. The last place to close that tunnel or stop the error from reaching the patient is us. As a nurse, we have the last chance to close that Swiss cheese tunnel, not letting the error get all the way through the cheese tunnel to the patient. Nurses are ultimately responsible for that error occurring, as the last stop before the patient ended with us. Medication errors are a massive problem in healthcare settings. Doctors, pharmacists, nurses, unit clerks, we're all human and we can all make mistakes. No one is perfect. Medication errors occur for many reasons, and sometimes we're not able to stop the medication error. The best way to stop one from happening is following those medication checks. But let's look at some of the common reasons why errors occur. The first is inappropriate prescribing of the medication. This is why we need to make sure the medication makes sense for what's wrong with our patient. Another error is caused by extra doses, omitted or not given doses, or wrong doses. We can also give the medication to the wrong patient. We can give the medication by the wrong route or at the wrong rate, and we can prepare the medications incorrectly. We can give the medication incorrectly, and we can give the medication too early or too late. Another thing we can do is give medication that it's deteriorated. One thing that we should always do is double check something if we're ever in doubt. Okay, so how do we actually stop these errors from happening if there are so many ways that they can occur? One of the first things we can do to help prevent medication errors is doing medication reconciliation. This is where we organize and list all of the patient's current medications, doses, and last times taken. This includes over-the-counter and herbal medications, as well as alcohol and recreational drug use. We do this upon admission, transfer, and discharge. We share this list with all providers caring for the patient, especially when the patient gets transferred. And we give a copy of this list to the patient when they're discharged. In the EMR world, med reconciliation is fairly easy, but in the paper world or downtime, we have to do this all by hand, and mistakes can easily happen when we forget to list drugs. To stop errors, nurses need to complete the 6 writes and 3 med checks every time we administer medications. We must also know all of the information presented in the pharmacology PowerPoints. We need to know more than just memorizing drug names. We need to know the actions, the doses, the side effects, and how to monitor the drugs. And we need to know how to apply this knowledge to various clinical situations. I will say that once you start your first nursing job, you'll find that some units use the same medications over and over again, and you'll get to know those drugs very well. For me, my unit always gave oral aspirin, Plavix, and Percocet to everyone. I didn't have to think about those drugs. I knew what to do and what to look for. And if I had a patient with a drug I was less familiar with, I looked it up. Remember, I told you in week 1 that nurses never stop learning. If a drug error occurs, the first thing we need to do is check on our patient. Remember, assessment is the first part of the nursing process, so go assess your patient. The person could be dead in the bed before you go and do anything else. After we assess our patient and potentially do some life-saving interventions, we need to notify the charge nurse or nurse manager and the provider. Then we need to follow our facility's policies for reporting errors. Some use incident reports, some use variance reports. It's facility specific, and we're going to learn more about incident reports in a later week. Another thing we can do as nurses that's a great way to reduce errors is educate our patients. When we give medications, we have to educate our patients on the medications every time. We educate them on the use, side effects, when to take the medications, how to take the medications, and any other important information the patient may need. We also need to educate the patient on not sharing their medications with other people. How does this stop errors? Well, if you walked into a patient's room with the wrong medication and started to teach the patient and they say, I don't have high blood pressure, but you're there to give them a high blood pressure pill, this should stop you in your tracks and make you investigate the medication you are thinking of giving. Maybe the med is going to the wrong patient, or maybe isn't being used for high blood pressure, but a different condition the patient has, or maybe the order was a mistake by the provider. Either way, this is a good step to stop, investigate, and potentially stop an error from occurring. And this is the end of medication administration part 2.